Home health agencies provide skilled or paraprofessional health care to individuals in a non-hospital setting, such as an individual's home or assisted living facility. Avis Jenkins with Nurses and More is here to give us the details. Now, Avis, I was not familiar with the term home health agency. So in a nutshell, how would you explain that to someone?
A home health agency is an agency that provides skilled care post-acute services, typically when they come out of hospital or when they come out of a rehab facility or a skilled nursing facility where they need additional care to kind of get to their next best level of health.
And this is obviously something, we were chatting off camera that this is either covered by Medicare, Medicaid, private insurance.
Private insurances and even private pay.
So, you know, if someone had an individual that needed something different that was not covered, they could go and just kind of do a separate payment for a service?
Not quite that easy.
Oh, okay.
But we can talk about that a little further. When we go in to assess a situation,
okay,
we kind of determine how long care should be afforded to that particular individual, and we work that in as a part of the collaboration with the physician or the nurse practitioner or the physician's assistant. And after they've met that goal, if they want continued service, and that's when you can talk about payment outside of the regular
I see.
source.
So maybe give us some examples. Okay, you have a loved one that has contacted a home health agency and they have someone coming back to their home after surgery. What kind of services can be provided?
Well, we provide services based on the orders from either a physician, from a nurse practitioner, or from a physician's assistant. And they dictate what particular skill is necessary, whether it's nursing services, occupational therapy, physical therapy, medical social work, assistance in home with a home health aide, or a certified nurse assistant. Those things are kind of dictated by the order from the practitioner.
And I did mention in-home care, but we've also mentioned that if someone is in an assisted living facility, that agency can go there as well.
Well, the assisted living facility is their home.
Right, that's
and I
true.
think sometimes we forget that just because they're in a larger area with several other people living communally, it's still their home.
So now we've covered some of the examples that can happen, but is there anything that you don't cover?
Home health aid or home health agencies don't typically provide long-term care. We are a transitional. We are to help that person get to their next best level of health. When they are in need of something that's more substantial and more long-term, that's when we look to some of our partners like private duty or private pay. We don't pay for those extended home health aid visits that are 15, 20 hours a day or 24 hours a day. That's outside of the home health aid focus, or the home health agency focus.
So it's really just that temporary kind of hand up to get the person situated back in their home, or, well, the assisted living facility, their home there. And I would imagine this really is a help to the family and loved ones, because that situation isn't pressed solely on them.
Absolutely, and it is definitely transitional. And say, for instance, a person came into home health and met their goal and then declined, absolutely, referrals can come back and we can go back into the home. It is transitional, but it's not just because you've made it to your goal that's the end of it for you.
And now, just very quickly tell us, I know it would be very important to find the correct, licensed, I want to say legitimate health agency. What should somebody really look for those details?
Well, in the state of Florida, everyone is licensed through the Agency for Healthcare Administration, ACA. And you can always go to that website, to floridahealthfinders.gov, to look for agencies, and it will tell you whether or not they've had any issues with
that's great.
reports. You can also go to the Medicare Care Compare website, and it will give the star ratings, which talk about how well that particular agency does in comparison to other agencies.
Great, and we can put all that information up on the screen so folks can find those agencies. And Avis, this has been very informative overview of home health agencies. Thanks so much for stopping in.
Thank you.
This is great.